Next. I would now like to call upon Dr. A.N. Supe, sir, former director, ME and MH, former dean.
Sure. Thank you.
Okay. I would request Dean Madam and Harish Pathak, sir, to chair the session.
Okay, now we are here only. कोणाचं? माझं कसं बरं? ठीक. काय झालं? Sure. Very respected Chairman, Dean Madam, Dr. Oak, all the deans, all my colleagues and friends. I think I'm going to talk today on what is AI has done basically in hospitals, what is the role it, but I'll begin with what is AI for some of you who may not have. Can I just ask how many of you have used ChatGPT in your hospital, in your daily life? Only about 25. I'm a little shocked. In a hospital like ours, 100% people should use it. But anyway, those who have not used, I'll begin from very basic. But I'll try to take you what is the scope of AI today in our hospitals. Thank you, Sangeeta, Ravindra, and of course, my close friend, Chinmay. Now, if you've really seen, medical science has improved tremendously, and it has improved the expectancy of people. I mean, if you really see, the age has increased, the disease patterns have changed, we have better control, but it has also increased the rising cost, demand for their service, and workforce struggling to meet the needs of the patients. Patients' needs have gone up. And this is where we are now struggling with the whole health system. In this whole scenario, AI has really entered in last, say, few years. So we need to know what is AI, what are its advantages, what are its limitations. Now, AI has been growing influence into the healthcare. If you all see, AI has really come in a big way. You know, what it was called as an artificial intelligence, now it is called as a deep learning. Current era is called as a deep learning. In fact, every day you see AI coming up in a big way. I'm sure you've seen Atlas. How many of you have seen Atlas? No. And then I'm sure this Baaton Mein Aisa Uljha Ja is a beautiful movie on AI. And of course, Digiyatra and Google and everything, if you find, AI has entered our life in a big way. In fact, look at the publications in PubMed on AI. It's almost more than 2 lakh publications in AI which have really come. So rapidly growing this particular field. Now our OTs have changed. You know, we have so many variables. I'm sure half of you I saw wearing the digital watches. Everybody trying to look how many steps I've done, how much I walked and everything. This is all, how many variables, CGM, continuous glucose monitoring, everything you're seeing our OTs, thanks to Dr. O, who gave me this OT like this. So let's begin with saying that how does AI work in life? I'll go very briefly. I'm not going to go in details. Each of these can be a full, I mean, AI can be 3 days conference. You know, that is kind of a material today we have. Now, basically, the data has increased too much. Every 73 days, data doubles. You know, today, I mean, 73 days, whatever data is coming in the literature doubles. Now, we are not able to cope up with this. So what we really need is a data crunching. We need to have summary of all data which gets published. So all that what data comes, we need wisdom. From the data to information, information to knowledge, and knowledge to wisdom. We want to jump to the wisdom, and that's what we are all looking for. So if you see, there are so many predatory journals have come. People are using it for promotions. You know, so many articles, and this is many times a junk, actually, if you really see. This is not of use to anybody. And then we get lost into those articles. So we really need to know which are these good articles. So what it really does, AI, it goes through the machine pattern, learns patterns, make predictions, and perform tasks. And this is what exactly AI wants to do it. For example, it puts all, aggregate the patient population. It will generate population-based recommendations, and it will give you personalized patient-centered decision-making. It will give you profiles. I will talk about it more, how they really do it. In fact, if you see traditional prediction, models predicting appendicitis, you find accuracy is much better with a simple thing like an appendicitis. Now, another thing it does is it cause image analysis. For example, this is a cat and dog. So if you put thousands and thousands, lakhs and lakhs of images of cat and dog, it will start recognizing what is cat and what is dog. And that's exactly your amount of data you put. That is where HMIS is very important. A hospital like KEM puts 20 lakh OPD data and say 85,000 IPD patients. The kind of data which is generated in municipality, you will find it's amazing kind of patterns we can recognize. We can convert into multiple layers and we can get what we really want. In fact, image sampling to classification and then working on neural networks, and you get all the kind of patterns. Especially today, I want to know whether my cholecystectomy is, where I have done the dissection is adequate. There's an app which you can really know, and you can know whether you have done it well. So look at the next thing which came in AI was AI and generative AI. What do you mean by generative AI? See, basically artificial intelligence is a broad concept. But generative AI is a subset of AI which is focused on creating a new text, images, or music. For example, ChatGPT. It's a generative AI. It will create a text for you. And I'll show you some examples. We have actually recently I conducted many workshops on ChatGPT for doctors and research, and which I thought is something which is eye-opening for many of us. Involve the creation of new unique outputs that are explicitly programmed, often resembling inspired by existing data patterns. So these are the three new things which have come this last year. ChatGPT came. Microsoft Copilot today is already part of Microsoft Binge. It is in your worksheet. You can use it. Gemini is done by Google. And Claude 3 was introduced in March 24. These are all very recent ones, but they give you so much of information about this. So what does it do? It gives you a basic framework. It is accessible. It's freely. Now, I'm sure yesterday only the Apple said that ChatGPT 4 is available for Apple users. I think this is, and I'm sure there was a reaction by Elon Musk. I don't know how much of you read Twitters and all. But if you realize, now if Apple is coming out with ChatGPT 4, you know how much easy it is going to be. My phone is going to be studied with all the knowledge. Then efficient and provide workflow, reviewing writings and summarize articles, critically analyzes your work. So, but it cannot provide real-time information. The kind of ChatGPT 3.5 is a frozen data. It is only up to 21. If you want up to 24, you need to go for ChatGPT 4. And faulty memory, sometimes it hallucinates, sometimes it gives you wrong kind of information. So generic output and plagiarism, absence of mature subject areas, and it does not have a personality of its own today. Now, ChatGPT can be wrong at times. Look for details. It may give you framework. So ChatGPT 4 is updated and a paid version. It's very costly, about 2,000 rupees per month. So it may not be cost-free for us. But now if Apple phone is going to give you, it might be cheaper for me. ChatGPT 5 will be launched this year. By July or December, they are saying that. It will give me everything, even the statistical tests, mathematical outputs. It will give me healthcare, and technology is going to completely change with ChatGPT 5. So we should be updated about it, what we are really going to do. These are all general chatbots I told you. But what is important is the academic chatbots. There are thousands of academic chatbots which have come. And we as an academic institution, we should be aware of these academic chatbots. What are those? These are interactive AI applications, serve as virtual assistants for you and serve as research assistants for you. For example, I will give you only few examples because you can't really speak everything in 45 minutes. So Chat Doc is the best tool. You can really go, you can use your Google to accommodate into this. Chat with documents. Now you have many times you're doing thesis and you have many summarizing to really do it. Okay. Now you want instant answers and cited resources. Ask for a file and you get instant info. So what you do, you just put this file into this. And in the next place, you will get the summary of that article. You will get exactly what does this article want to say. Now it is so easy. Many times you have 100 documents to go through. At least you put in those and they'll give you exactly what summary is. At least you can screen through those documents and read some of the documents in detail. You can be so more efficient in doing all this. Analyze research papers at superhuman speed. Illicit is one of the programs, I can give you hundreds of programs like this, which will probably help you to do this. Impact on surgery. It is going to change the way surgery is being done. Look at this video. This has come from Japan. This is typically now, I don't know how many of you used Open AI, Apple Open Pro Vision 2, which has come now. Now, see, this is a Eureka where you will find this robot is guiding the surgeon to identify connective tissue, nerves, and pancreas. Amazing. Tomorrow I'm doing, say, anything, right hemicolectomy, and I want to know where is the ureter. I just put it. It will tell me that the injury to the ureter is so less. Injury to the CBD is so less. Injury to the nerves is so less. Simple things. But this is all AI guided. And this has now come. See, there's a way we normally look at. Previously, it was only knowledge. Now it has come in practice. So we should be aware of all this. So AI and ML will tell you, in fact, laparoscopic, it will tell you predict difficulty of surgeries. It will tell you what are your port placements based on the patient's body and all that kind of thing, where your instrument size, how it is going to really fight, layering of tissues and dissections and steps of surgery. In fact, what we normally talk about is intraoperative holographic navigation. That means we normally would like to know exactly what anatomy is in a 3D, and I can really go around it. And I'm sure we can really talk about it when we do intraoperative kind of an help. Then impact on practice. If you look at gynec and obstetrics, if you really look summary, this is from Massachusetts Journal. IVF laboratory is completely done by AI. Selection of embryo to really doing this. Predicting preterm birth, 94% accuracy. Estimated fetal weight, predicting successful vaginal delivery. And these are all fairly recent papers. What is its impact on medical education and training? Huge impact. In fact, if you really see, mixed reality has come into picture. Real environment, augmented reality, augmented virtuality, and virtual environment. We have completely changed now the way we teach. You should teach our students. Now, virtual reality, we all used to do it. Now, I don't know. There is something called as in India now, this Optic Vision Pro 2 has already come. HoloLens has already come. If you've really seen it, for example, I'm operating a patient. I just put on that green. And if I want to CT while doing an operation, what I have to do is I just put my hand and I do like this. I'll see CT of the patient and I just say this and the CT will go. Makes my whole life easy. Otherwise, I have to wash out or I have to stand out. I have to go to the viewing box, see exactly what it is and come back. Now, all this is done by just your fingers. Now, it is something which is amazing. You have to just go through. Look at this image where I can see the lever, rotate it. The way I want to handle it, I can do it. And I can know exactly the vascularity of this lever. Now, if I'm operating with this kind of a clarity, you know how much of impact it will have on the patient's safety. And today is a world of patient safety. We all talk about now patient safety, patient experience, patient delight. All these are something which are based on all this. Something like this, you can create a huge lever. And you can create a lever of this particular room size and put it a hand and rotate it. And this is all done by your augmented reality. I can create a vision like this. I can create, say, I have to do now, say, left hepatectomy. So I just create an image like this and I put it there. And now during the operation, it is going to guide me all the time how my vessels are going to come. And once I know, put a laparoscope or something, I can easily know that this vessel is coming now. So I'm more careful. Otherwise, it's all judgment. Now I have more clarity how I'm going to do this. And this is something which will completely change. I've been working on HoloLens for last few years, and it has been an experience. We have been teaching in various countries like Bhutan, Nepal, Cambodia, and we are going and teaching them and trying to develop the whole concepts there. In fact, if you reach Apple Vision 2 Pro 2, which has come recently in USA and now is going to get launched in India, it's going to be completely a game changer in surgery. And it costs only about 5.5 lakh rupees today. And many Indian people will do it. Look at this kind of a lap myomectomy, so many things which you can really see this. In fact, we published a book, Artificial Intelligence in Medical Education, which you can really freely download from this particular place, and you can know what is the kind of impact AI has on a medical education. Now, let's come to the topic of the day. What is the role of AI in hospitals? Now, I'm sure HMIS, I'm sure I tried it my best to do it. I was partly successful, partly the work remained half, because I don't remember, as Dr. Oak rightly said, the programs are made, but when they are implemented at a doctor's level and nurses level, there's a lot of kind of an resistance. But it has a long term, a great advantage for us. So if you really see this, early detection of the health problems through artificial intelligence technology in a hospital information management. If they do a literature review, they have done a completely the systematic review. And what did they really find? Early detection of health problems needs to be supported by optimal hospitals. So once you have a data of, say, 46 iPads, like in Zen Hospital, also we have those iPad systems, 80 iPads, and everything gets documented. Now, the question is, if you go at a further level and make an OCR data, we'll be able to get patterns of patients, and we'll be able to know how it is really coming. Now, this is of such a great help for a clinician who is sitting there. You have 20 patients of fever. Dr. Nadkar wants to know, what is the pattern today? Viral, typhoid, anything. It will give me a complete picture of your, say, 100 patients in last 2 years or 1 year, and will tell you what is the pattern of disease and what pattern of investigations, which if you try to analyze manually, it will take a hell of a time. But this can be done in minutes, and it will help the patient's treatment. So areas of impact of AI in a healthcare: improving population health management, improving operations, and strengthening innovations. This is the main area, like chronic care management, self-care prevention. In fact, if you really look the top areas, the clinical decision making is becoming a big, this is where the softwares are making a huge kind of advantage. Personalize. I'll talk about it a little more. What is a DNA nudge technology and how do they really do it today? So self-care and prevention and triage and diagnosis. This is somewhere the hospitals have adopted all this. In fact, diagnostics, clinical decision-making, self-care prevention, education, this is where healthcare impact is already today in an AI. Now, another important thing I thought, where the AI has made a lot of importance, about, say, when I was a dean, I don't know, Dr. Oak, you remember, but there was one dean, one fellow came from Scandinavia, okay, and he showed an iPad. And at that time in 2016 or something, he showed me that they have in a hospital what is called as a flow management system. So I was thinking, like, say, we have a casualty where 800 patients come, 200 require ICU. It's utter chaos every day when you enter in the evening at 7 o'clock. You find, how do you really manage? So then he showed me many examples, and I'm sure it's very difficult to get such softwares in our hospital through whether tender or not. But today, crowded casualties in all over the world are managed through what is called as an patient flow management, intelligent patient flow management. So what they normally do, they would look at the trajectory of landmarks, they would look at various models, and they would AI-assisted acute patient journey mapping, they do it. That means they would look at it, how many patients, who needs urgency, who needs X-ray, CT, how can you adjust it, and then the messages go. And the whole kind of an AI software will probably make your time and the performance quite well in your casualties. So this is becoming very popular all over the world, and this is coming up in a big way. In fact, today, if you see mass casualties, we see mass casualties very often in our hospitals. So AI now is used in mass casualties. More than 15 patients coming in our hospital should go into this particular system, and it will tell you, because see, I must have managed so many mass casualties in this hospital. Every time, though we have tried our best and we have done it much better over years, I think there's always some degree of a chaos and misconfusion does occur. I think there's a way of really handling these kind of things which can be better done with these kind of new techniques. Documentation is something which can be grossly improved by AI. If you want to do any documentation, one of the simple thing, I know most of the residents today want to write operation notes. They write it very badly. I can assure you this. So I wrote in chatbot, write an operation notes for difficult laparoscopic cholecystectomy. Just you put it. And within seconds, you get a complete notes. Now you have to really look at and make few adjustments based to the patient. And you will find that your operation notes are ready. Of course, there's an issue of cut and paste like what happened in radiology. But if a resident is smart, he can reduce his work and make the life easy for himself. You know, something like that. You can get pathology results, always check for correctness. Now, that is where the surgeon has to go. So, chatbots in a hospital can be used for creating notes, discharge summaries outline, creating schedules for doctors, writing drafts and letters. Tomorrow you want to write a draft. You know, many times, you get a phone call from head office कि तुम इसका proposal बना के immediately भेज दो. And then you go on preparing 7 days, 8 days. By the time the decision makers change their decision and we lose that grant. Now, easiest way to make proposals today, make a draft. Ultimately, you will have to put your humanness into this. It's not going to replace you, but it helps you to do this. Day-to-day routine text generation, and we can go and talk anything more on this. Improving diagnostic in hospitals. The hospitals have completely changed the way diagnostic. Diagnostics are usually becoming one of the main areas in AI. For example, AI to differentiate benign versus malignant. This has become very common now. You have a lesion like this, use of artificial intelligence differentiating malignant lung nodules. Many times you see lung nodules or liver nodules on a liver. Now, we used to normally use judgment and to say this is benign or malignant. But today, I think we can use programs, we can give scores, and we can really find out whether this is benign or malignant. This has now become very common all over. I mean, in COVID times, I think this was used very often. Detecting, classifying lesions of mammograms on deep learning. You normally have all kinds of authors and you see they would definitely find out breast lesion. In fact, there is an international evaluation of AI system for breast cancer screening. Now, these all guidelines have already started come. Forget about research papers. Now they are into guidelines and now they are into practice. So we are slowly inching towards a practice of AI into. So we are going from stage 2 to stage 3 and we are going. So what is called as a metaverse, which is in digital health. So, in 19th century, we used to have X-ray screening for making a diagnosis of TB. Then we started using low density CT scans. Then the word came high density CT scans. And then now AI, VI and AR, and now there is something we have an AI system to make a nodule diagnosis. So we are now changing ourselves to make a complete diagnosis in a different way. Now, unless we understand that we are changing, we will never be able to really go. So if you ask me, what does it can, AI can do all mundane radiological work. So the radiologist is now available for doing creative and critical work. So every time they say we have too much of load, use all these techniques, make your life easy, and then you can really do creative work. Prevention and planning treatment. IBM and Watson, IBM Watson for oncology delivers an advanced ability and information. I mean, Watson for oncology identifies and tanks potential treatment. It would really analyze you, find out what is the best treatment for you. In fact, AI has been used for preventive care, mammogram, lung cancer screening. You will have multiple layers and it would tell you exactly what it is. Cardiac kidney, polycystic kidney disease, you have a patient like this. And you want to find out how many nephrons are remaining and what is the risk in that. It will definitely tell you there's a score for this. In fact, cardiac risk assessment. Many times you go for a CT scan and your vessels are calcified. What is the risk of you getting cardiac attack or you're getting C? I'm sure, many times the CT may show calcified vessels, but that is all now calculated with all this cardiac risk assessment. Predicting stroke or heart attacks. This was paper from the European Journal of Radiology. Performance of AI based on coronary artery calcium scoring in a non-gated chest CT. So these are all benefits of lowering health cost over a period of time. In fact, AI and mental health has come in a big way. Previously, people used to say AI is not useful in mental health. But AI can also identify the risk of mental illness, suicide among patients with psychiatric disorders, or among certain populations like prisoners and soldiers. I think this is something which I was impressed with one paper, that artificial intelligence could help identify students with mental health issues. Now, I think we had a lot of discussion in the month of January. Somebody did a suicide. Can you identify him early? So this paper says very nicely, with the help of the intelligent focus technology, schools can detect the withdrawn behavior that is often sign of mental illness, can detect it quickly. So people have started using this intelligent way. People are now trying to look at it. The most important is AI for research. Many of you must be doing thesis as a postgraduate. And you will find idea generation itself is a problem for many of you. Which topic to take, what hypothesis to create. Now, what is important, you first see, you require a human element in all this, but you can use AI to make many things easier. Something like Copilot, you can use research question for anemia. It will give you. In fact, you can ask Copilot to create hypothesis and then you can tweak it. Makes your life much easy for you. Then smarter literature reviews. If you want to do smarter literature reviews, you can really use it. Many times, we don't know, for example, you take a topic and you don't know who is the best man in the world who has used this. Or you many times don't know what is the similar work which is likely to be there. So there's a site called as a Research Rabbit. You go into that, it will give you research work, similar work, it will give you the network amongst the papers. And it will give you everything what you wanted to really conduct. So it will help you to make your research work better. Writing assistant is something which I told you is important. I showed you this picture of summarizing the documents. Then it also tells you many about enhanced efficiency. For example, I just put this into ChatGPT. I gave them a data that I have a group data like this and B group data like this. Can you perform t-test and tell me the significance? Because that's always a common problem for all of us to calculate t-test. I'm sure you can do it in Excel, but ChatGPT gave me such a wonderful answer. Sure, we can do this. It gave me analysis of this. And it gave me at the bottom line, since our calculated data is so and so, it rejects the null hypothesis. And therefore, this is statistically significant data. So imagine we can really do so many things with this. The good thing I realized what ChatGPT was about paraphrasing. See, many of you don't have a good command on English. And we copy sentences and we write it down. And then it is got into plagiarism or something like this. So how do you really go about this? So I wrote this. KEM Hospital is one of the top hospitals in country and well known in Asia. In spite of high patient load and limited resources, it provides affordable best treatment to needy patients. So I thought we just wanted to put this. Now it can give it in a very nice way. It's a recognized prominent healthcare facility in the nation, enjoys a strong reputation. And I have put it as a routine kind of an paraphrasing. If you want to put a creative, it would give you a creative. It will use different words. So imagine if you want to use your thesis articles and you want to use a paraphrasing, you can use it in a very different way and use the same thing with high patient load. The meaning is same, but it has given me a better paraphrasing. So this helps me in writing wonderful papers. Another thing was I wanted to cite properly. So I just wrote that. Can you cite my article in a Vancouver style? That's a common problem with you. You know only some part of it. So I just wrote down a study of stress of medical students by Avinash Supe, so and so in a postgraduate medicine. It goes to the net. It finds out what is the volume. It puts it properly into the Vancouver style. Imagine the effort I had to, otherwise would have spent about 10 minutes to do this. I do it in 10 seconds. So that makes your life easy. And this is the use of AI. You should really do it. AI and forensics. It is a forensic conference. The most important use of AI today is in a pattern recognition. Today, there is a huge world of pattern recognition where there is a fingerprint, shoe print, dental print, everything. There's a pattern recognition has become very popular in AI. Automation of data and predictive analysis. That will help you in all these. These are the new features of forensics which help you to make a diagnosis. In fact, if you really see virtual autopsies and all are different things, but if you do virtual autopsies, it can give you a predictive data analysis. Of course, there are limitations like it can have biases, lack of context, and you have to really have a striking balance between complementing it and not replace humans. The best example was China. China has 100%, almost 99% primary education, while India has only 67%. That's the basic difference in education. So China had a big problem. So what did China do actually? China had facing a poor access to care, lack of awareness. So they actually use AI in many services, and they started using chatbot. And in fact, they use WeChat platforms with AI services, and they started working on web chat-based physician community for patients, treatment management as an AI imaging platform. So this is something which has come. What are Indian hospitals doing about AI? I think let's think about it. Are we India? Are we doing anything? So Microsoft, Apollo, and AI. Apollo Hospital and Microsoft India launched the first AI-powered CVD risk score of APN. I think Milind may be knowing all this. But this is where this was done somewhere in 2019, 2020. So they created first cardiovascular disease risk score. Then, if you really look, the Madurai-based hospital, like, I mean, they really did this with Eye Hospital and to stop prevent blindness. And Arvind Eye Care with AI has a big program of, they have their whole data and they find out who's the retina and vitreous is at danger, and they call them back again and they would like to do it. Have you done anything, KEM and AI? And how many of you are aware that we started working on AI way back in 2016? You know, I remember this when I was a director. That time we started working on this AI in eczema. And this is a paper published in International Journal, but the work was done in 2016 with Dr. Coker and one principal from one professor from the mechanical engineering. And we published the first app of AI to diagnose eczema or skin diseases. You know, we have how many patients we get of skin disease? We have 800 OPD patients roughly, out of which you will find 400 patients have a simple dermatological thing which can be treated at a GP level. Now, if you want to cut down on our OPDs, we need to create these apps and they can be seen. Anybody get a suggestion. I'm not saying they'll get a perfect diagnosis, but they'll get a suggestion where you can cut down and our simple kind of thing. Those which are complex will be always coming to our hospital. Another thing which work I had done was role of AI in predicting monsoon outbreaks. Now, many of us, you know that during monsoon, we have a set pattern of diseases. You know, monsoon has started. In next few days, you will find people walking through water. They will get lepto outbreak. Then you will get malaria. Then followed by somewhere in the month of August, you will get typhoid. And then when the water starts receding, the rain starts receding, we'll start getting a dengue outbreak. And all of us get stuck for 4 months or 5 months. Many times we are not able to predict what is the kind of disease pattern which is going to be there. AI has already done this. AI Science Predicting Infectious Disease, 2024 paper. And in fact, this is one thesis which was done with our health department, predicting dengue outbreaks in Mumbai region based on disease surveillance. And this was a big data approach. And in fact, there are big data analysis of forecasting and modeling epidemic outbreaks. And I think these are all published papers that are done work from our corporation. It's not that we are behind, but I personally feel every department can do this work and take it ahead. There are so many opportunities in a hospital like ours. So I think we need to go ahead in this. There's something called the DNA nudge technology. Now, today, diabetes is managed with medicines. Today, there's something called as they create a parallel avatar profile. You know, for example, I don't know how many of you really read. So they will create, if I'm Avinash Supe and I'm being treated for diabetes, they'll create a profile of Avinash Supe as a diabetes. And they start using DNA nudge technology. And that's the way my diabetes gets controlled. So there may be similar patients with a different profile, maybe needing a different kind of a treatment. So now we are rushing towards a personalized treatment. And, you know, this is all being done in our own city. You know, I think these are all, they would do it this way. In fact, there was a conference about 2 months ago, March 24. It was the AI NAMS conference where from Mumbai, there are many people who presented their work about DNA nudge technology. So this is becoming common today. So we need to understand that in hospitals, AI has already entered and we need to be aware of all this. What is the impact of AI on hospitals? Let's understand this short-term, mid-term, and long-term. In a short term, we will go for a low-hanging fruits. Like we will start using image recognition, triage, helping people with chronic diseases to manage. And radiology, pathology, ophthalmology, dermatology will start using this. In a midterm, you will have a clinical workflows, cancer diagnosis, and predictive analysis. While in the long term, we will have a clinical decision support and DNA nudge technology. So we are now going to go towards more personalized medicine with AI. Last few slides about ethics and AI. There are now guidelines for using AI as a scholar. Don't use it blindly. Just don't copy and paste it. There are European guidelines which are already come on this. There are EU guidelines, and there are so many Indian guidelines are likely to come. So we use within that framework of guidelines. Probably it's not a very difficult. In fact, my granddaughter came to me and asked me, can you explain me this AI ethics class? Imagine this, in a 5th standard or 6th standard or 8th standard, there is an AI in ethics is there in every classroom. I don't know how many of you really look at your children's curriculum, but try to look at it. And I'm sure you will come to know that this has already come in curriculum. So what is future? Last week, China opened an AI hospital in China with 14 AI people and 4 nurses. They can manage 3,000 patients. This is already there. Let's see this experiment, how it works. So we want to see how it is going to work. There are some advantages like increased accessibility, and there are some problems of human touch and technical. So what is future of AI in research? Today, we have to look for collaborative intelligence. AI and humans should work together. Autonomous scientific discoveries, ethical AI governance, and democratization of AI. So if you really see, AI came in a big way, then it went down, and now it has come to a plateau of productivity. So now we have started understanding AI over years. So now it's the time we are trying to bring into practice. So we have now autonomous surgical robots, the way I showed you. Then we have preoperative planning, intraoperative guidance. For every aspect, AI has really entered in healthcare. So the last question is, will AI replace humans? Is it going to change all of us and make us job free? AI is not a magic bullet that fixes everything. Now, the classic was a film called Sully. I don't know how many of you have seen, where the AI component was the human component was so important. He saved life of patients only by his human judgment. And so we don't want today radiologist. We want a radiologist with skills of AI. We want a surgeon with skills of AI. We want a dean with skills of AI, because he will probably give us the best kind of a solution. So if you really look, we need to look at 2 paradigms. One, on repetitive work versus creative work, and interaction-based versus data-based. So repetitive work will be taken by AI. Creative work will still remain in human mind. And data-based work will be again go by AI, and interaction-based will remain as it is. So if you look at the specialties, they are divided like this. So specialties like, say, psychiatry, neurology will be not much affected. But radiology, dental will be affected grossly. And surgery will be partly affected, and geriatrics will not be so much affected. So it's very interesting game we need to watch future. Okay. So AI will never replace humans. Physicians have a non-linear working method. They will have always task algorithms robots can never complete, like counseling a patient or relative for a complex surgery. So it is not technology versus humans. It's humans and human technology working together to achieve better health. Artificial intelligence and humans are the most potent when they cooperate. So AI has come to stay. AI has potential to improve your surgical outcomes. AI will never replace surgeons, but it will augment their performance. So thank you so much.
Thank you, sir, for this enlightening session.
Yes. Any questions, please?
Any questions? You have anything you want to ask?
All are searching chat doc on the document. Found it.
What question I should ask? Anyway, if you have not gone through all this, it's an awakening call.
Really awakening.
I want you to go back and change yourself, because this is something which is coming. When Google came, people were worried like this. Now, don't get worried about AI. and don't get completely lost by it. Just use it. That's what message I want to give.
सेंटेनरी में AI पे कॉन्फ्रेंस तो रखना ही है अभी. I decided today.
Yeah, sure, anytime. We can do it at that. Yeah, sure. No, these are something which all of you should understand.
Yes.
No, what? Government has coming with all guidelines also, but for your data keeping and all, see what is the risk in all AI? Data privacy. See, if you're doing a thesis and you're putting it, is once it goes, it can be, the idea can be hacked by somebody. So that's the risk always there. So I think these are all risks of AI and data. Now also you put your thoughts into Google anyway, but summarizing paper, writing site properly, all this, who is going to stop you to not use it? Government anyway using it. I mean, for getting tried, I think during voting, I think so many AI was used. Anyway, I mean, sure. Thank you so much.
I now request our chairpersons to felicitate Sir with a bouquet and memento. I now call upon Dr. Milind Nadkar Sir to felicitate Dr. Sangeeta Rawat Ma'am. Chairpersons. Photo. I now call upon Dr. Ravindra Devkar Sir to I now call upon Dr. Ravindra Devkar Sir to felicitate Dr. Pathak Sir.